In our presentation, we will be talking about the Buffalo Creek flood, which took place in West Virginia in 1972, and how to be prepared for a flood.
Residents were just awakening that Saturday morning. Some entire families were still in bed. In the end, more than 125 people were killed, at least 1,000 injured, and some 4,000 left homeless. The headlines the next day played the catastrophe as a flood disaster, as there had been heavy rain. Yet, as all who lived in those parts knew well, this was a coal disaster, not an act of God, as the coal company would later claim. On February 26, 1972, a sludge dam on the Middle Fork of Buffalo Creek in Logan County, West Virginia, gave way, unloosening a torrent of thick, murky water that claimed at least 118 lives, left 7 persons missing, destroyed hundreds of homes, and left thousands homeless. This was the result of Pittston and Buffalo Mining disposing of solid waste material by the most convenient and cheapest method possible. This has been done by dumping refuse on hillsides and in hollows in close proximity to cleaning plants in order to cut down on haulage costs.
So preparing prior to the disaster. Preparation is a key element in successfully navigating a flood similar to that of Buffalo Creek. You're going to want to be aware of your area's flood risk. This includes weather patterns and the type of terrain you live or work nearby, as well as potential hazards including dams or rivers that can easily overflow. Many communities that are in high-risk areas will have a form of communication to alert residents of potential hazards. This may include alarms or services such as the NOAA weather radio. Downloading, subscribing apps or these services, or even awareness of these tools may save you precious time in the face of a disaster. You're going to want to make a plan to coordinate communication with loved ones in order to verify safety. You're going to want to make sure that any important documents or valuables are going to be stored in waterproof containers in convenient locations should you need to evacuate. By practicing evacuation plans and discussing flood signs in action with family and the community, familiarity has a chance of replacing fear when disaster does strike.
It's important to be prepared for a disaster because once it happens, it's too late. Having a checklist helps you determine what you need to have and what needs to be done. These are just some practical things you can do and practical items to have on hand for a disaster. Some key items are creating a household evacuation plan, making sure everybody knows their assigned roles, assembling a portable emergency kit, having those things on hand because you never know what's going to happen. Food and water supply is very important. Assuming you are able to leave by car, hopefully you get out quick enough, it's important to have this emergency kit full of food and water, flares, maps, tools, first aid kit, sleeping bags, waterproof gloves, sturdy shoes, boots, long sleeve shirts, and especially insect repellent containing DEET.
In the event of a flood, the first thing to do is try to get to a safe location. If you are told to evacuate, do so immediately. Avoid the floodwaters and if trapped, get to the highest level. All power should be turned off, sockets unplugged, and light bulbs unscrewed. Furniture should be elevated if possible and electrical equipment stored in high places. Do not eat or drink contaminated food or water. Waterproof bags should be used to store important documents, food, water, and other items that need to remain dry. Sandbags can be used to block floor drains and toilets to prevent sewage backup. Listen for disaster updates via radio or smartphone.
Safety after a flood is where the reality of the disaster sets in. It is essential for those who are able to evacuate the scene to remain away from the area until direction is given from local authorities or broadcasts. The damages caused by the flood will have health hazards and numerous safety issues such as electrocution risks from standing water and fallen power lines, injury from debris, mold, food and water contamination, chemical hazards, hypothermia, and fires. In the Buffalo Creek flood, there was roughly 625 survivors from the gallons of black water that washed out multiple communities. The flood reached 10 to 20 feet over the communities, damaging hundreds of homes, automobiles, bridges, power, telephone lines, country road, and rail lines. Those who survived did not have anything after the flood. The damage is estimated around $50 million. To attempt financial recovery, those who survived sued Pittston Coal Company and received $13,000 each for a total of $4.8 million overall.
During natural disasters, healthcare workers are highly relied on to help the community cope with initial injury, survive, and recover. Due to an extensive knowledge base, nurses can be expected to assume many roles when dealing with disasters. The nurse should remain calm, as well as flexible and prepared to switch roles promptly if necessary. The nurse can be asked to perform such tasks in their own facilities as protocols allow, or ask, or in the community on site, depending on the severity of the disaster. In a flood setting, if the nurse can safely get to their institution to help, they should do so. If they are not present and not able to transport safely, they should stay where they are. The nurse that is not present at their institution can be a useful resource in the community with similar tasks, such as delivering first aid and educating community members on how to get help. During a disaster such as a flood, the nurse can be assigned to tasks such as triaging or assessing the status of patients, delivering first aid, providing medications, assisting with mental health needs, and providing education such as how to care for injuries sustained during the flood.